Millions of Americans are filing for unemployment amid the coronavirus pandemic. Many who have lost their jobs have also lost health insurance. In our financial fallout series, we've been reporting on the economic impact of the coronavirus. Our consumer investigative correspondent Anna Werner reports on the health insurance options for the unemployed.
This is the street that is generally filled with people and tourists.
The beach in Myrtle Beach, South Carolina is empty, as is the hotel where Donna Zweig used to work as food and beverage manager until last month.
They very kindly said that, they're going to have to let me go because they just don't have the business. They're going to not be able to open up the restaurant.
Zweig moved here last June from New Jersey and took on 2 jobs, one full-time at the hotel, another part-time at a university. But she's now lost both. For how long isn't clear.
The uncertainty, the anxiety, the mental pressure, financial, it's beyond anything I have ever experienced. I don't think any of us have.
Making things worse, her new health insurance was supposed to kick in April 1st. Now she's having to postpone a needed medical procedure.
Can't afford to pay for it out of my pocket.
Is that something that could impact your future health?
Oh, definitely.
That's something Minnesota Dr. Hannah Lixon says she's seeing daily.
The absence of our patients is really striking, and it's scary to me.
Some patients simply aren't showing up, she says, because they no longer have health insurance.
Are you infuriated? Are you sad, upset?
All of those things at once. It is devastating. I'm sad for my patients. I'm afraid for my patients. And I'm angry that we as a society created a healthcare system that didn't actually prioritize the health of our patients.
Insurance options for people who are now out of work can be complicated. The Affordable Care Act allows people who have lost jobs now to apply through special enrollment to state health care exchanges. Many can get subsidies. Prices and plans vary. Some laid-off workers qualify for COBRA, temporary coverage, but it can be expensive. And if their incomes fall low enough, some people will be able to get Medicaid, but often only in certain states. Health policy researcher Dr. Aaron Carroll.
We've done almost nothing to try to ease the path or to make it easy. In fact, it appears to be incredibly difficult.
What's worse, he says, many states appear to be overwhelmed.
It takes a significant infrastructure to do all of the checking and signing people up and checking to see if they qualify for subsidies and doing all of that. It's not clear that right now in April, a lot of the exchanges, especially at the state-based level and at the federal level, I guess, are actually staffed up and prepared to do that.
To me, that's outrageous in a country as rich as ours.
Senator Mark Werner and other Democrats are now proposing a bill to reopen enrollment for the Affordable Care Act and expand Medicaid in states where it hasn't yet happened, so people don't put off getting care.
Somebody, God forbid, who may be coming down with signs of the virus should not be afraid of going to the doctor because they can't afford to pay. In this kind of circumstance, that kind of reluctance to use the system actually endangers all of us.
Donna Zweig isn't sure any help will come fast enough. She's put the house that was going to be her home in retirement in Myrtle Beach up for sale.
It's not going to do me any good, this house, if I can't pay for it.
Now, to see what your options might be under the Affordable Care Act, you can go to healthcare.gov. They'll ask you a few questions and guide you through to see what the options might be in your state. Now, if you have a story to tell us about this or any other problem you're having, send us an email at healthcosts@cbsnews.com. Tony?
Yeah, please do. Talk about a double whammy. And Anna, as you point out, the options for people who lost their health insurance after losing their job, it's complicated, it can be expensive, doesn't seem to be a good choice out there. So yes, please write in, folks. And Anna, thank you very much.